Studies have shown that penal institutions all over the world are environments for fast and uncontrolled spread of HIV and other sexually transmitted infections due to many risk factors, including unsafe sexual practices, as well as poor healthcare and living conditions. Hello and welcome to another episode of The Last Mile with NACA. I am Adesuwa Osui. This episode torchlights a study conducted in Nigeria's correctional facilities under the leadership of the National Agency for the Control of AIDS, NACA, with support from the United Nations Office of Drug and Crime. Keep watching.
Inmates in correctional facilities are key populations who, due to specific higher risk behaviors, are at increased risk of HIV, therefore are key to the dynamics of HIV transmission.
HIV in general is driven by a population group we call key affected population. They constitute less than 2% of the population of the country. However, they contribute almost 11% in terms of the burden of HIV. And this category include sex workers, those that are either on the street or they are brothel based, men who have sex with men, transgender, people who inject drugs. They also inject HIV in addition to drug. And people that are in correctional facilities, we also classify them as a high-risk population. We're focusing on this population growth because we believe if we get to control HIV within this group, we will achieve greater part of what need to be done, to make sure that HIV is kept without allowing it to move. And key affected population are central to this effort. So that is why our effort, that is geared towards key affected population also extends to correctional facilities.
It is very important to pay attention to these key populations, especially prisons that we're talking about, in the sense that when they finish serving term, they return back to the society and they integrate with the general population. So if we say, oh, these people are key populations, we don't want to do anything with men who have sex with men, we don't want to do anything with female sex workers or people that are in prisons, it's a taboo to talk to them, they'll still fall back into the society. And when they do that, they'll reinfect, persons, or they'll infect people in the society. And by so doing, we will not be able to control the prevalence. It will still begin to go up, and sustaining the response will have been eroded or would have eroded the yields that we gain from all the activities we have done. So prison population is termed key population because of the peculiarities of the environment which they are kept.
To reduce new HIV infections among this key population, a situation and needs assessment of HIV and AIDS, drug use and related health services was conducted under the leadership of the National Agency for the Control of AIDS, NACA, with support from the United Nations Office on Drugs and Crime, UNODC, in some correctional facilities across the 6 geopolitical zones of Nigeria.
In trying to manage HIV/AIDS, and you consider this population key population, they contribute significantly to the HIV/AIDS in the country. So it became important that you look at the existing situation in these correctional institutions. What happens in these settings? What are those activities that contribute to their vulnerability? What health facilities are available to them? are they able to access these health facilities available to them? Even if you provide health services to these people, are they able to access them? So we needed to look to kind of give us a background as to how to better approach this population and control HIV/AIDS in this setting. And it was done in collaboration with the Nigerian Correctional Service, with funding and technical support from UNODC, that's the United Nations Office for Drug and Crime. Yes.
While previous HIV studies have been conducted in correctional facilities, they have been limited in scope and coverage. This was aimed to characterize HIV, tuberculosis, and hepatitis B and C among inmates.
What this assessment did for us was to help us pinpoint the key vulnerable people in the correctional institutions, what services they need, so that you're better able to provide targeted interventions to these people. You're better able to provide targeted planning, implementation with regards to prevention, treatment, care, and then support. Do you understand? Because now we speak more and more of epidemic control. If you're talking about epidemic control, you cannot ignore this population. You want to address more targeted intervention.
It was quite interesting. We went about 2,511 respondents cutting across the 12 states, including FCT, responded to us. And at the end of the day, we found out that, yes, there was low knowledge, low perception of HIV, TB, hepatitis. So overall, HIV prevalence among inmates in the correctional facilities was higher than the general population. It was also highest among women in the correctional facilities, and we discovered that in between, the 6 geopolitical zone, it was also highest in the North Central zone, while we got, I think, the lowest percentage in the Northeast correctional facilities.
The same study was also carried out in the 3 Borstal institutions located in Ogun, Kwara, and Kaduna states.
The federal government have correctional institutions called booster services for younger persons, and when you go there, it's not the usual correctional services that you have in your mind. It's a school, and they were like students will be in every other school, and properly maintained and disciplined. So in all of these places, we found out there was a bit of sexual activities ongoing as well. HIV prevalence was a bit high, and the perception was low. Access to healthcare was still low, to life-saving medications, except parents brought for the children in most cases. So with the interventions put in place, there's room for these young ones to access their life-saving medication, and also partners to bring in prevention methods like condom and all, so that they can use when they're having sex and all that.
The National Assessment of HIV and AIDS, Drug Use and Related Health Services has further strengthened the existing collaboration between NACA and the Nigeria Correctional Service.
In conducting this assessment and situation analysis, one of the biggest challenges we had was access to this population. You have a lot of bottlenecks. They also have to consider legal issues. They have to consider age. They have to consider consent. There's a bunch of bottlenecks they have to consider also to be able to just grant us access. But the good thing about this exercise also, it has strengthened our relationship with the correctional institutions. So going forward, collaborating with them becomes easier, Access to them becomes easier because you have established a good working relationship.
This collaboration has given us a lot of strength in managing the inmates because they support a lot in terms of clinical materials, you understand? Not only in HIV/AIDS management, but other related diseases from HIV/AIDS. So that makes our work easy.
The prison services stakeholders in the fight against HIV, we've been working together since when the multi-sectoral approach to HIV control was adopted several years back. And we have units within the correctional facilities that are reaching out to provide services. When we do surveys and we go around to test to see how much prevalent HIV is, we do it together with the leadership. Likewise, when services are provided, those services are given together with the leadership.
It is expected that policymakers and relevant stakeholders will leverage the finding from the study to formulate and monitor policies, programs and strategies that help develop targeted services for inmates in correctional facilities.
The CGC wishes to thank NACA for their efforts towards the coordination of various organizations, international bodies and agencies involved in the HIV/AIDS program in the Nigerian Correctional Service. NACA has been there for us from inception till date. Your contributions have immensely impacted the Correctional Service HIV/AIDS program and activities. We have over the years enjoyed your relentless efforts in several measures, including the recognition and positioning us as a key population and vulnerable group. We say a big thank you for this to NACA. Training and retraining of our personnel on HIV/AIDS and other related activities, making it possible for the service to be able to manage people living with HIV in our environment, ensuring that always we are not left behind in all areas of HIV/AIDS activities.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
This HIV self-test kit has been certified safe and effective by the WHO, Federal Ministry of Health and NACA. For more inquiries, call the NACA Information Center free of charge on 6222. Do not eat, drink or use mouth cleaning products 30 minutes before the test. Find somewhere private with good light and a flat surface. The kit includes instruction leaflets that should be read carefully, a test stand and a sealed package containing a test device, developer tube and preservative used for storage only. This is not needed for the test. Open the test tube and place it in the test stand. Grab the test device by the handle. Do not touch the flat pad. Apply moderate pressure while swabbing the flat pad once along your upper gum and once along the lower gum. Immediately put the test device in the developer tube. Leave it there for 20 minutes before reading the result. Do not read the result after 40 minutes. Test is positive if both control and test lines appear, in which case you should contact NACA Information Center as soon as possible for advice on the next step. Test is negative if only control line appears. Test is invalid if there are no lines or only test line appear, or the wipe result background becomes red and should be repeated. Properly dispose all contents in the normal trash. Support NACA and the fight against HIV. Know your HIV status today.
The update segment brings you highlights of NACA's activities across the country and elsewhere. Stay with us.
The Nigeria Network of Religious Leaders Living with or Personally Affected by HIV and AIDS, Ninarella Plus, recently organized a stakeholders dialogue to set agenda for faith-based consultations on stigma and human rights in the HIV context. Amber Itohan, the Executive Secretary, Ninarella Plus, shed more light on the purpose and expectations of the event.
It's a meeting that we, the faith-based, want to develop or set up an agenda that speaks on issues around human rights and HIV and AIDS. So we're having all the faith-based here, different faith leaders from the different faith groups that are seated here wanting to develop this agenda. And this agenda is going to help us to address issues around prevention, issues around treatment, adherence, and thereabout. So it's something that we've been looking forward to come up before now, and we're happy that this is actually supported by PEPFAR and UNAIDS for us to be able to carry this on along. It's setting up an agenda is also going to help us in the issue of the U equals U, for us to attain virus suppression and that. So we're very glad that we're able to do this, definitely.
The Northeast Zonal Coordinator, National Agency for the Control of AIDS, NACA, Tobias John, is of the opinion that stigma and discrimination can end if stakeholders, especially religious groups, take responsibility.
Almost 99.9% of Nigerians belong to either Islam or Christianity. Now, you know very well that what a faith leader tells you, you might believe it better than what another person tells you, even government. So if the faith leaders take up this campaign, we have the belief and confidence that the right behavior change that can actually deal with stigma and discrimination will be dealt with. Many people died as a result of stigma and discrimination. But many people today are alive because they were able to overcome stigma and discrimination, whether self-stigma or community stigma. But anyhow you look at it, why stigma is a monster to us is that it's because of stigma that people are afraid to go and test. It's because of stigma that people are afraid to take their medication when due and openly. It is because of stigma that people cannot even tell people about their status. But once we put that to an end, HIV will become like the normal blood pressure, or I have headache, you carry paracetamol, and that automatically will end AIDS as a public health emergency.
Tobias John also commended the federal government and leadership of NACA for their commitment to placing more people on treatment.
The reality about the potency of treatment now is the fact that anybody who is living with HIV/AIDS, who adhere to treatment, who achieve viral suppression, even he has sex without protection, cannot transmit it. We have a government who had taken bold steps to start placing 50 people on treatment. And within the government, they now cut off a lot of vendors who were doing business with HIV consumables and medicines, and now go directly to the manufacturer. Now the manufacturer, from before, we were treating one person per year to a cost of over 120,000. By going straight to the manufacturer, boycotting all those middlemen, it now come down to like 50,000 per annum. That is from $15 per head to now $7 per head. Now, The response now is more organized and more scientific and more focused than it used to be in the past. There is heavy improvement in all areas.
The Executive Secretary of Muslim Ummah of Southwest Nigeria, Professor Musli Yahya, delivered the keynote address.
We need to bring the faith, our religion, to the center of ending stigma, and because it also involves right violation. And if we are going to do that, we have to follow the tenets of what our religions teach us, so that it will be an advantage from our nation. God says He can forgive all sins as long as you seek repentance before you die and come back to the right path. And if God can forgive sins, what stops us from forgiving sins? Therefore, it is not our business to judge one another. It is our business to make sure that we individually live according to the tenets of these religions that we are talking about.
Some participants shared their thoughts.
I think love is key, fairness is key. These are messages we should go out with. Justice is key. This is a message we must leave here with, so that at the end of the day, we help ourselves to make this world a better place. So it's a joint effort, and the religious leaders are just trying to make their own contribution to us having a better society.
If we can understand and appreciate that what is central to everything we do is love, then we will not discriminate or stigmatize against any individual, no matter what situation they're in. The second thing for me is the knowledge gap about how we understand what the scripture says concerning us and concerning any issue that we talk about. And then lastly, for me, is the importance of ensuring that we can separate religion from cultural practices.
Religion's voice in its communities and its ability to stimulate grassroots responses allow faith-based organizations to have a critical role in impacting the prevalence of HIV and AIDS throughout the world.
What we want people to know is that there is an act against HIV, stigma, and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a #1 enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesuwa Osui. Goodbye.